Welcome back. Well, today I am joined by Dr. Roger Sohn, who is here on behalf of MemorialCare. He is an orthopedic surgeon in sports medicine. Well, Dr. Sohn, thank you so much for joining us. We appreciate it.
Thank you. It's a pleasure to be back on the show, Lisa.
Well, I'll tell you, we've all been trying to stay busy, and some people have been busier than others. And, I wonder if you can maybe address, we're going to talk about shoulder arthritis that leads to shoulder surgery. So maybe you can tell me, does shoulder arthritis develop when we are active or when we're not active?
Excellent question. Well, I think in general, I think the question is it good to be active? And I think the answer is yes, you should be active. But is there a point at which you can overdo it? And the answer is also yes. I think I can't tell you how many people I've seen during this pandemic who have been into a new sport. They can't go to the gym, and so they've picked up mountain biking or something else. And some of these are really great, and they're definitely healthy activities. But I have had a couple of patients who have said, in their 60s or 70s, has said, I've picked up a new, weightlifting program, which I've never worked out this hard before. And lo and behold, they're starting to aggravate a shoulder, which has like an early amount of arthritis. So it certainly can make things worse if you're not careful about it. But no, in general, I tell people to be active. Being active is good. You've got to live your life, especially in these crazy times.
And that's a good point, because I remember talking to one of the gals who, she goes, yeah, I've lost like 40 pounds. And we're like, what? And she said, yeah, I've been exercising so much because there's really not much to do, right? So of course, naturally, you're going to have people come to you going, oh my gosh, I've never done this before. And now all of a sudden I'm doing it. So yeah, they do need to be careful. Like you said, even though it's important to exercise, they do have to be careful. When you talk about shoulder arthritis, what are some of the symptoms that would make us think it is arthritis and not just an injury?
Well, one of the hallmarks of shoulder arthritis, there are several, loss of range of motion. It doesn't usually happen suddenly. People start to gradually lose their range of motion. They notice as time goes on, they're having trouble raising their arm up to, maybe get into a shelf, or they, as they reach behind their back, to get dressed or wash during the shower, they notice that their range of motion isn't what it used to be. So loss of range of motion is one of them. It's usually painful. People start to notice that, especially at the extremes of range of motion, as they move their arm around, they start to feel pain in the shoulder. Another one is, it's not always a dead giveaway, but a lot of times people will have a crunchy sound. We call it crepitation, where they actually feel like something is actually a rough surface on the inside of the shoulder. And that's exactly what arthritis is. It's actually the breakdown of the smooth gliding surfaces of the glenohumeral joint, or the ball and socket joint of the shoulder. And so as the movement happens with these rough surfaces, people feel that sort of gritty or crunchy feeling as they move the shoulder.
Huh. That's not age restrictive though, is it? I mean, that can happen at any time.
I'll tell you, I recently had a 39-year-old gentleman who was telling me, I can't pick up my 2-year-old daughter. And, he ended up being a good candidate. We did a new type of replacement on his shoulder that allows him to remain active and without as much fear for the future of things loosening. But yes, it can happen at any age, but most of the time it does happen to people in their late 50s and in their 60s is when people start to really present to the doctor with arthritis. And x-rays will show that they do have this type of arthritic change in the shoulder.
I see. So let me ask you this now, instead of having a shoulder surgery or I don't know if you replace shoulders, do you actually do that?
Yes, that is, yeah, you've probably heard of hip replacement and knee replacements. Shoulder replacements are much less common. They're about 2% of all the replacements that are done in this country. But yes, they are an important joint. And when the joint breaks down, we can replace it. The technology has really advanced. In the last 10 years, as I watched the technology improve, it's quite impressive. The stems have gotten much shorter. The plastic is getting better. And yes, we can replace the shoulder and have very reliable results. So yes, we do shoulder replacements.
Wow. That's crazy. I mean, like you said, technology is assisting in so many different things these days. We're going to turn into the bionic people. It would seem. I mean, you put enough stuff in you almost feel like you are. However, there are other treatments or other types of non-invasive things that you can do. What are some of those?
Yeah, absolutely. You hit on it earlier about being active, and Many times people come to me and they've got a little bit of arthritis in the shoulder, and we'll get them on an exercise routine, a stretching routine. We want them to maintain their flexibility, have good posture. A physical therapist can really help with this.
Mm.
And some people who have more moderate arthritis, where arthritis is one of these things where you get a flare up of your pain, then it calms down, and people are able to take things like anti-inflammatory pills. You've probably heard of Aleve, Motrin, Mobic, Meloxicam. These types of medications are really good at reducing those flare-ups. But a lot of times our strategies are aimed at when someone comes to me and they're in acute pain, they have a flare-up and their shoulder is hurting, they can't sleep, they're having trouble doing even basic tasks. A lot of times we can get it better by putting a cortisone injection in the joint, because that just breaks the cycle and it reduces the amount of swelling and pain in the shoulder, and they can get back to that level where they previously were, where it wasn't quite so painful. So those are some of the things that we can do earlier on in the earlier stages of arthritis.
What are some of the restrictions with cortisone, though? I had some elbow injuries before, and I understood that there's only so many cortisone injections that you could actually do. Is that true?
You've heard correctly. And I think in the olden days, people used to get a lot of these injections because the doctors and the health community, we just weren't aware of the side effects. I'm talking about a decade ago. More recently, we've been more aware of these. We know that if you get too many cortisone injections, that it causes the cartilage to break down a little bit faster. We know this from the knee literature, for example. It also can weaken the tendons and ligaments in the area. But we think a safe amount is if you get 2 or maybe 3 in the, like one shoulder during a year's space of time, that's safe to do. And so I have several patients who come back once or twice a year and they get their cortisone injections. But of course, it's not going to cure the problem. It's not really there. It's not going to put the cartilage back in the joint. And a lot of times people live with some limitations. They know that their shoulder is still not what it used to be. It has some arthritis in it, but they would rather have some non-invasive treatments like an injection just to keep them out of pain.
Right. Well, I would imagine that, you do have to have some recovery time with surgery, and therefore, maybe people can't take off work or whatever the case might be. So they use this Band-Aid to get them by. However, at some point it's not going to work and they're going to have to end up having surgery in the long run. So what kind of surgery are we talking about, and what is the recovery like?
Great question. It's come a long ways. The surgery is still a traditional replacement of the shoulder joint. Like I alluded to earlier, though, the implants have gotten a lot smaller. We used to have these big stems that look like hip implants that would go down the humerus. Now they even have stemless implants that we use. It allows us to make smaller incisions. It allows us to have less blood loss, and it allows us to send people home much quicker. So even before COVID happened, we were sending the majority of our patients home the same day as surgery, not just for shoulder replacement, but for other joints as well. And I think a lot of good things came out of this that COVID accelerated. So as the hospitals became aware of the limitations in supply and just the beds and so forth, they've been encouraging us to do as many of these surgeries as we can on an outpatient basis. But thankfully, because of the buildup over the last several years of the expertise we've developed in doing these as outpatients, that was not really a problem. So typically what happens is we get the surgery. It can be done at the hospital as an outpatient procedure, or it can be done like, for example, Saddleback has a surgery center, which is not technically even an inpatient visit. So the patient can be sent home from the recovery room. We place a nerve block so the arm is comfortable afterwards. They go home to recover. Patients feel comfortable recovering at home. They feel safer there. They're in their own environment. Right. So the first week after surgery, people are generally in a sling and they're not doing too much with the shoulder. We ask them to start doing some what we call pendulum exercises, where they swing and dangle the arm. And then we start some physical therapy after we check the wound. But generally after about 6 weeks, it's safe for them to do most activities around the house. That includes driving, that includes, grooming and cooking and things of that nature. Most around here, we have a lot of golfers. Golfers usually aren't going to be swinging a club till about the 3-month mark. And usually between 3 and 4 months is when they really get back on the golf course.
That's not too long. I mean, you know what, if you've been suffering this whole time with a shoulder injury, then, might be well worth the time, because then for the rest of your life, you shouldn't have to be worrying about your shoulder.
That's exactly right. It's an investment like anything else. And you asked about the recovery. There is a partnership. I ask my patients to observe certain precautions, and people do get out what they put into it. So if patients do, do their part and they and they follow the restrictions and do their physical therapy, they generally are happy with the investment of time.
Right. Well, that's awesome news. And then one last thing, we all want to be able to prevent something like this from happening. Although you're not going to be able to tell people to stop playing tennis or stop playing pickleball or stop lifting weights because we're all still going to do it. But what are some things that we can do to prevent this from happening?
Well, that's a great question. I think one thing to keep in mind as you think about the answer to that question, or the way I think about it is, arthritis doesn't usually happen as a sudden event. It usually happens as a culmination of many small injuries to the shoulder or just a gradual decline in the cartilage thickness of the shoulder. So that being said, many people will come to me and they have a very, very early stage of arthritis, like a grade 1 arthritis. And if they're very low, I tell them, look, you've got many years left of service on this shoulder joint. So if you're gentle with it, you will get a lot more, and you don't necessarily have to get to the point where you need something surgical done about it. So I go back to the first question you ask is it good to be active? Yes, it's good to be active, but again, be kind to your joints. You only get a certain amount of cartilage when you're born. And as we get older, it's like a bank account. We spend that cartilage, and once it's gone, it's gone. There's no getting it back. And at least as of right now, as of today's filming, we don't have the technology to put the cartilage back in the joint. I think at some point that will be there. That's kind of the next frontier, if we can get there. But right now we don't have that. So yes, be kind to your joints. Try to make them last a long time. Don't go out and start a new, CrossFit gym or something like this. Now is not the time for that. You want to maintain. Maintenance is the name of the game.
Excellent. Well, thank you so much for your time. Appreciate the information.
Thanks, Lisa. It's always a pleasure to be on your show.
All right. Thank you. We'll be right back after this.